I think that once our boys and girls are showing signs of puberty, I think discussions about issues related to sexuality are perfectly appropriate. And a good example is that a lot of times when the girls are 13 or 14, they've been told by somebody that if you've got diabetes, you can't have a baby because it will kill you. A good example is there was a Julia Roberts movie called Steel Magnolias, and you may remember that she had a severe hypoglycemic seizure and her mother didn't want her to have a baby and all this kind of stuff. Well, the reality is that certainly people with type 1 diabetes can get pregnant and they can have babies, but unlike well, all of us probably should plan pregnancies, and teenagers in particular, we know that the most common reason why teenagers get pregnant is because of an accident. That is to say, they did not set out to get pregnant. That was not their goal. And so we have very frank talks about sexuality, about how you get pregnant if the children don't know that or the adolescents don't know that, and we talk about steps that can be taken to avoid pregnancy. Again, the diabetes team is very comfortable doing this. I'm also very comfortable, and almost all diabetes doctors are very comfortable saying to the mom that, you know, I know you may be a little uncomfortable about me talking to your 15-year-old daughter about sexuality, but it's a normal part of life, and we know that, especially in girls with diabetes, that pregnancy needs to be planned. And so I just need to be real clear that my job as a pediatrician is to not make you, as the mom, happy. My job as a pediatrician is to be sure that your daughter is safe. And if and when she chooses to become pregnant, we need to have a clear plan that this is a plan to become pregnant. And it's sort of interesting because in 30 years, I think I've only had about 3 parents that have objected to me actually having these kind of frank conversations with their daughter. And in all 3 circumstances within a year, the parents came back and said, you know, I'm really glad that you did have that conversation with my daughter. I think our job as physicians and as people who take care of children is that my primary commitment is to the child, not to the parent. And I think that we all get training and we all have experience in talking about these sorts of issues. They're a normal part of growing up. For the boys, so we talked a little bit about the girls. For the boys, we certainly talk a bit about sexual responsibility, and we talk about keeping themselves safe. Obviously, they're not at risk for getting pregnant themselves, but a major emphasis in our clinic is always that adolescents need to get a good education, and one of the surest way to interrupt the educational process is to become a father when you're 17, because then you have some other people that you have to take care of, and that usually results in people dropping out of school and going to work at, you know, a fast food restaurant or something, which means that that child doesn't get the good education that they otherwise might have gotten. So we certainly have those conversations as well with the boys.